If you work on a computer and you've ever felt pain in your hands or wrists, you've probably wondered if you have carpal tunnel syndrome. But how do you know if it's that serious? And if it is, what do you do about it? Dr. Mark Deitch from OrthoMaryland joins us this morning with more on that. Good morning.
Good morning.
All right, so what exactly is carpal tunnel? What does that mean?
Carpal tunnel syndrome is a condition where the nerve, the median nerve that runs down the wrist, gets pinched in a very narrow space. This nerve needs to fit through a very narrow space or tunnel surrounded by 9 tendons, and if anything that causes inflammation of the tendons, that will encroach upon the nerve and cause some compression, gives you some symptoms of pins and needles and pain.
And so just prolonged use on your typewriter in the improper position will do that to you?
It can certainly contribute to it. People associate keyboard use with carpal tunnel syndrome. It's not the only cause. There's plenty of people who use keyboards who don't develop carpal tunnel syndrome. So there have to be a number of factors that contribute to it, but certainly using your keyboard for a prolonged period of time in a bad position would contribute to development of symptoms.
So how do you know if whatever pain you are experiencing is carpal tunnel? Are there tests that you all can do to signal that?
Well, first and foremost, if you have a sensation of numbness or pins and needles in the fingers, especially the thumb, index, and middle finger, and sometimes the ring finger as well, that's consistent with carpal tunnel syndrome. You can have pain that radiates up the front of the forearm, even as high as the shoulder. In terms of tests for carpal tunnel syndrome, of course, examination by a physician is needed. And you can also do a special test called an electromyogram or nerve conduction velocity test, which actually tests the nerves.
So the big question is, how do you treat it and can it be cured?
Well, it certainly can be cured. It's a very common disorder and it actually is very easy to treat. First and foremost is changing the causative factors. That is, if you're typing on a keyboard or on a laptop in a position which is causing a lot of stress or inflammation on the flexor tendons, you want to try to change that position and change the way you do things. Take breaks, change the position you're using your keyboard. You can also use things like wrist braces, which you sometimes wear at night to prevent you from curling your wrist down, which also contributes to the symptoms, or things like anti-inflammatory medication, which can decrease the swelling of those tendons and decrease some of the symptoms.
When is it so bad that it requires something else, or does it get to the point that you would need surgery or something more drastic?
Well, surgery is certainly the last resort, and that is if you've tried all the non-surgical treatments and you still have symptoms, then surgery is a consideration. And surgery is a fairly simple, straightforward procedure. It takes about 30 minutes, and what it involves is basically allowing that carpal tunnel space to enlarge to take the pressure off the nerve.
All right, well, there's a cure. That's the good thing. Treatment for it. Thank you so much for coming in.
You're very welcome.
Well, if you would like more information, you can log on to our website, foxbaltimore.com, and click on Your Health Matters.